one?
No, sir.
The month of May, salaries $49.51, fringe benefits $15.28, operating expense $207, public outreach $141, phone $40. Any questions on that one? Okay. Now, activities. Now we get into the numbers. The numbers for April. April of 2020, in the heat of the COVID, we had 21 visitors in April of 2020. When you compare this April, we had 125 visitors. If I did my math right, it should be an increase of 104 visitors. Total number of clients assisted in April of 2021 was the 491. That's with phone calls and those other activities. New clients during the months of April of 2021, we had 4 new visitors. Through the year so far up through April, it was 23 new visitors. Nursing home / home visits are 4. Outreach events 2. In the month of April, we filed 17 claims. We were notified that the VA decided 26 claims. Again, those claims were all old, previously filed many months ago. Of those 26 decisions, 23 were favorable, 2 were denials or unfavorable, 1 stayed the same, neither changed, went up or down. Any questions about April's activities? Okay, the month of May of 2021.
I have a question.
Yes, sir.
Unfavorable, does that mean the person gets decreased benefits?
It can happen. They can get benefits decreased, but when I report unfavorable means I file a claim for an increase or a new condition, and the VA says it's neither new or it got bad enough to increase the benefit.
So sometimes that unfavorable just means status quo remains.
Status quo would be confirmed and continued. It stayed the same. Unfavorable means it was a denial. So if you say my hearing has gotten worse, then the VA sends you in for an exam.
Okay.
Your hearing is the same. It's confirmed and continued.
But they're not decreasing their benefits.
99.9% of the time, no. But I always warn our clients, I'm glad you brought that up for everyone listening in YouTube land. The VA can decrease benefits, and in some cases, they can sever or take away a benefit. So I'm always very, very upfront with my clients,
It's a gamble.
and I let them know your benefits can go up, they can go down, they can stay the same, and in rare instances, if the VA finds they made a mistake in your file years ago, they can propose to sever a disability. And then the fighting begins, and the arguments begin with VA, and we find doctors and that are favorable. And anyway, yeah, that's a big mess that we don't get into a lot, but it can happen. I'm glad you brought that up. So during the month of May of 2021, we had a total of 586 individuals that were assisted. We had 3 new clients in May of this year. Year to date, through the end of May, we had a total of 26 new visitors to our office. We didn't do any house call or nursing home visits in May. 2 outreach events. We did 11 claims were filed. We were notified of 13 claims that were decided by the VA. Of those 13 claims, 11 of them were favorable. Usually they're claims for an increase or a new condition. In other words, the person never filed it. Unfavorable, again, 2 were denials or unfavorable, and nobody stayed the same. They either got denied or they got approved. Let's take a look at our next slide. So we'll look at monthly VA income. I always like to report every month when I tell the commissioners we won 13 claims or 20 claims, though I combine the data, the income for those 12, 13, 14 people. In this case, it was 23 favorable decisions during the month of April of 2021. Those 23 individuals combined are going to see just under $19,000 a month in new benefits to their household. In a year, that will equate to $227,035.44. And those 23 individuals combined received over $80,000 in back pay. Now let's go ahead and take a look at May of 2021. Those 13 individuals that won claims If I pulled all their resources together, those 13 individuals are going to receive a little over $16,000 a month. In a year, they'll all receive just under $200,000 a year. And back pay, these 13 individuals combined received a little over $76,000. So let's take a look at year-to-date. The next slide. Through the month of April, through the end of April, 71 individuals that we helped won their claims that were favorable. Those 71 individuals combined a little over $81,000 a month, little over $980,000 a year, and a little bit under $500,000 in back pay. Now we're going to fast forward through the end of May. So as of 5 or 6 weeks ago, is that what it was? 4 or 5 weeks ago? The end of May. Let me start by, there's a typographical error. There's not 82. That 82 should be 84. So these 84 clients that have won claims through the end of May combined a little over $98,324, $1.1 million over a 12-month period, and over $500,000 in back pay. Any questions about our monthly income and yearly, if I multiply that times 12 months? The key, what I'm looking for in these numbers are, we haven't even hit the end of June, and we're already combined 1.1 million, and we're at the end of 5 months, and is that 5 months? Yeah. At 5 months into the year. So that's a pretty good figure. I like that. That's the things I look at.
Are you seeing a lot of veterans moving into the area?
I have been getting quite a few phone calls, maybe 2 or 3 a month.
Okay.
And the way I know it is because they call and they say, I was given your number by the clinic in Durango, and I need to get ported in my records for healthcare so that I can be seen at the Durango clinic.
Okay.
And so that tells me, besides the one that's actually show up in our office, I get phone calls typically saying, hey, we moved to the area, and I need to get my records medically so I can be seen here. And that's how I kind of gauge. It's about 2 or 3 a month. So
How do we compare veteran numbers to La Plata County or some of the other
La
counties?
Plata has almost double what we have
Okay.
In veteran population. So if we're running at about 20,
Right.
yeah, if we're about 21 to 2,200 that the VA can count, because remember, there's vets out there that aren't even asking for help.
Right.
So they're not even on the numbers. I talked to one this morning in Durango before I came here, and this guy was a VA employee in Grand Junction. He worked up there. And he's like, well, I never ordered my records, and I never filed for anything. And I'm like, well, that's pretty typical. You know, we're busy with school, work, raising a family, and then eventually talking to other veterans or other individuals. They're like, okay, fine, I'll file. So, but we're at about 22 to 2,300, depending on the numbers from the VA. La Plata's about 42, 44. So,
Thank you.
but I bet our numbers at the end of the year are pretty close to the millions of dollars. So, feel pretty good about our claim processing. So, but let me say this: they do have a new VSO over there, Greg Dotson. He's doing a fantastic job. He's only been there since October. We were helping him a little bit in mentoring him and getting him up to speed so that he can serve the citizens over there. And from all accounts, he's doing a fantastic job. He's already gotten access to VA computer systems. He's gone through all the accreditation. So he's up and running. He's accredited. He's ready to go. So good on him, which will bring me to Sarah in a minute. We're going to brag a little bit about her. A couple of highlights that I just want to have on the commissioner's radar. In April, we did, or highlighting what's gone on through April and May. We have started our veteran stand-down meetings. There's going to be a veteran stand-down. It's by the VFW, but they partner with our office in that event, and it was pretty successful the past 2 years. This will be the 3rd year that we do it. I think last year we were one of maybe 2 stand-downs in the whole state. So I think some of you may have come to that last year. Mm-hmm. So yeah, so we're prepping, we're having the meetings and our countdown towards that event, and that'll be in September, I think it's September 18th. Matter of fact, there's a meeting tomorrow night. And talking about Sarah, just like Greg next door, Sarah has been, as I reported months ago, she is an accredited service officer. She can do all the claims filings. She can do everything that I can do as an accredited state and county service officer. So we're excited about that. But the next level, or the next step that we're trying to do for her is, just like Greg and myself, is gain her access to the VA computer databases. So for that, she's having to take these classes. They're called TRIP. Don't ask me what TRIP stands for. I did them like over 10 years ago. But it's a series of about 18 classes, and it's all digital, and then she takes a small test at the end. I believe you got to take a little test. And then when she does all these 18 classes, she's doing security fingerprinting, she's going through the VA security processes, their classes as well for HIPAA, protecting private information. So once she's gone through almost 20-something classes, she will have access through it's called a PIV card. Don't ask me what that means either. Some sort of security card that has a chip on it, and then she'll plug into a computer, and she will be able to remote in to the VA computers, just like I do, and as if you were a VA employee. So basically, you can work and view what the employees in the VA are doing with our clients' claims. So to me, that's a big plus. I've had that forever, and I don't know what I would do without it. Well, I do. I'd be on the phone all the time with a VA employee. Can you look at this? Can you look at that? Whereas now, I just go look at it myself. As long as I have power of attorney and they've given me the authority, I can go in their files. So we want that for Sarah as well. It just helps our office tremendously by not having to reach out to the VA. With all that said, 2 months worth of information, are there any questions about anything over the last 2 months or moving forward?
You're doing a great job.
We're trying, thank you.
I have a question. I mean, we've got the folks here from the suicide prevention and childhood and stuff, but I was reading a book here lately, and I also have personal experience with veteran suicide, 22 a day. They say that the bravest, strongest thing a veteran can do is reach out and ask for help. And I would encourage any veteran out there that's listening in or whatever, if you have that thought cross your mind, seek out these people, and get some help. That's the bravest thing you can do.
Amen to that. Thank you, Commissioner.
Thank you, Rick.
All right.
Appreciate it.
All right, have a good week.
Yep.
Thank you, Rick.
22 a day.
Okay, Jennifer, we'll go ahead and bring you up.
That's like unacceptable.
Good morning.
Morning.
Okay, so May was a better month for us. We did 629 rides, which was up about double what we did the month before. We're still doing Meals on Wheels. We did 126, which was up from the month before. As of July 1st, there'll be no more IntelliRide, the brokerage system for Medicaid. So we'll be able to have our clients call us to make those rides, and we'll be able to go back to billing for ourselves, which is going to be huge. Because all of our clients, we had probably 4 or 5 that knew how to use the system. So everybody else was using us, but they were doing it under different grants or paying or that kind of thing. So this will be great. They'll be able to just call us and we can do it all ourselves again. I was told I was a big part of that because of all the stuff that I did to let them know what was going on. I did surveys from our people. I sent them to everybody who would listen. And then I got a call from what do they call them, when they're the lobbyist. And he told me that it was going to change. And I knew before a lot of other people, which was nice because I could kind of plan for it. We still need a couple of drivers now, though, because we're going to get busy again. Medicaid was probably our biggest client base as far as money-wise, because we get paid through Medicaid. So that's good news. Starting July 1st, we're done with that. So
Are those full-time drivers?
No, part-time.
Part-time?
Yeah.
Are
We
you-
don't,
Are you having problems getting help?
yes. Yes.
Just like
Just like
everybody.
Yes, exactly. We're not even having anybody really apply at this time. And with us, we don't, it's part-time and it's minimum wage, so it's a little harder to find people, some retired people, that's what we've got now is retired people and that kind of thing. So hopefully, we're gonna put it back out there and try to get at least one, if not two drivers. So, because we're at 4 right now. So we're busy. I have I've found a couple of vehicles on the Arizona website, a couple of vans that I'm looking at that have lower mileage, and I think one's a 2017 and one's a 18, but they've got low mileage and in the $20,000 range, I think. So, or 20 to 30, I guess I should say. So I'm hoping to get one of those soon. And then I've talked to our bus company that does the wraps, and we're trying to figure out how to coordinate getting them all done versus taking one to Denver or Colorado Springs and, one at a time. So I've been talking to them about that. So hopefully we'll have that done pretty soon.
So can they do them here in our shops, or do they have to go?
I asked them that,
Colorado.
and they said they might be able to meet us halfway to take the vehicle, but they didn't say they could do it here. They said they had to, because they've got all the equipment there, so, yeah. So that's going to be a challenge, but we'll get it done, so. And then hopefully we'll be accepted next year for a new vehicle and have the wrap already there. So we're already in the process of doing those grants. I'm also going to apply again for a grant to do the fixture house system, because I don't know what happened there, but they haven't even said anything about them. So, but they are back up on the board, so I'm going to try to get that again. So, but that's pretty much all I have today. Any questions?
No, thank you.
And we need to sign this contract.
yeah.
These agreements.
Yeah, AAA. It's for
Contract.
our AAA grant.
Okay.
Yeah.
We sign those electronically, or?
Nope.
AAA
We've
doesn't
got a
do
hard
electronic.
copy.
Oh, there we go.
Yeah. So, but that's for our AAA. That goes from July to June is the,
This right here.
Do you know if there's any
Yeah.
significant changes in it? I mean, I've looked at it, but,
no,
okay.
no.
It's 3 times more than last year, right?
For a AAA, it's not, it's a little more than last year, but not a lot. They're waiting on their federal funding, is what a lot of times they have to wait on that, so.
And in their meeting, they were having discussions about requests, and the chairman has resigned.
Mhm.
AAA.
Right.
Said that their funding hadn't come through yet.
Yeah. But there is a way for me to ask
Yeah,
for more.
I'm sure it will, but,
Yeah, it does eventually.
yeah.
Normally, but there is an opportunity for me to ask for more funding, especially since we've been doing the Meals on Wheels and stuff, so I'm going to try to do that. That's, I think, 2 months from now I can ask for that, so I'm going to try to do that. Because there's some extra funding that somebody else didn't use, so they kind of try to divvy it out before the end of the period. So I'll try to do that.
Well, I would move that we sign this agreement with the San Juan Basin Area Agency contract.
Second.
It's been moved and seconded to assign the San Juan Basin Area Agency on Aging in Durango, Colorado, in the amount of $42,138. All those in favor?
Aye.
Aye. Got it hidden.
That little yellow thing there.
Yeah. Okay,
Thank you.
all right.
Thank
Thank you,
you.
Jennifer.
Thank you.
All right, now I see more faces in the room. We'll go back up. I guess Public Health, well, you were next. we're kind of jumping around a little bit.
First come, first served. Enter and sign in, please.
Good morning.
Morning. I'm smiling under my mask, but sorry if I'm a little muffled today. I just feel a little tickle in my throat, and I don't want to spread anything around if it is something. So good morning. My name is Arlena Yazzie. I am one of the coordinators for the Colorado National Collaborative and Essentials for Childhood work at the Montezuma County Public Health Department. You guys know me. And so today we are going to be talking to you about our two programs, starting with the CNC work, the suicide prevention work. And then I'll pass it to Katie to talk about the Essentials for Childhood work. So today we'll chat a little bit about the CNC, our role in that, the SAFE Coalition, some of the supports that we are going to be asking you guys about today, and then we'll have some questions regarding the CNC. So starting with some information about the Colorado National Collaborative. So a number of years ago, some national level suicide prevention partners came together and realized that there wasn't really a comprehensive suicide prevention model from a public health perspective. So they decided, well, we should probably work on that. We should come up with something that works for us. So these national partners, like there's a number of them, but like SAMHSA, the Education Center, there's a lot of them. They decided to look across the U.S. and see, they scanned the U.S. to see which states would be willing to take on this work, which states had the willingness, which states already had movement in their suicide prevention efforts, and who had high rates of suicide. So they approached Colorado, like the state of Colorado, with this work, and Colorado said, yes, we'll take it on. So that formed the Colorado National Collaborative effort. And in that effort, they developed this, what we have today, this CNC suicide prevention model. And it's really a menu of different strategies that are evidence-based, that have proven to work. And with this model, they wanted to, of course, implement it locally to see if it worked. So Colorado at the state level decided to do another scan of the counties to see if similar criteria, who had the willingness to take on the work, what sort of movement did they have in suicide prevention efforts, and what are the rates of suicide and the means of suicide. So they approached 6 counties, and those 6 counties were Larimer, El Paso, Pueblo, Mesa, of course us, and then La Plata as well. So there was a real breadth of counties that they approached, and everyone that they approached said yes to the work. And in this, we are all in different stages of our suicide prevention infrastructure and efforts. Like Larimer County has been doing this work for a really long time through the Imagine Zero organization. And we, as Montezuma County, have not really had a sustainable effort in terms of suicide, like a collaborative suicide prevention effort. So there was a brief effort in 2017, and that was more youth suicide prevention focused. And we have had like a smattering of like individual, very siloed efforts. Like the Pinion Project does a really great youth suicide prevention, does really great youth suicide prevention work. There used to be like Escape for Life, which was just like an awareness event that would happen, but they're very scattered and siloed efforts. So,
and all of the county department heads took QPR in 2020.
Yeah, and
From you, maybe, was it?
no, it wasn't from me. I believe it was from the Pinion Project, possibly.
Sorry.
But I'm going to be doing those soon. Do a refresher.
Arlena, sorry to keep interrupting.
Yeah, no worries.
These 5 counties, 5 counties, don't they also have, weren't they identified because of their high suicide rates?
Yeah,
Is that
they
the
were also
highest in the
identified as
state?
high suicide rates.
Yeah.
So the question so we've been approached to take on this work. We all said yes. And the research question that we're basically trying to answer, this body of knowledge that we're trying to answer by implementing this suicide prevention model is in the next slide, to what extent does implementing a local, state, national collaborative, selecting a bundle of promising practices that responds to a county's data on suicide burden, and using an integrated comprehensive approach in selected Colorado counties, contribute to a 20% reduction in suicide at the state level by 2024. So the model that we currently have has 6 pillars. The first of those pillars is the connectedness pillar, and the strategies within this pillar are really focused on the extent to which people are connected, that their social fabric is strengthened, or to make those social fabrics stronger, so that people have connections, especially when they're in moments of crisis. So in this strategy, there are different populations that we focus on, including youth, veterans, and then specific workplaces as well, and a number of other populations. In the education, do you guys have a question?
No.
Okay, sorry. In the education and awareness pillar, this is, of course, just the strategies are focused around building awareness and education around how to ask someone if they're feeling suicidal, how to get someone connected with care. So one of the strategies is reaching out to populations that perhaps have a higher suicide burden or suicide risk, and providing QPR, question, persuade, refer trainings to those populations. The economic stability and supports pillars strategies are really focused on ensuring that families and individuals are economically stable. So strategies in this pillar include bringing together stakeholders in like housing, transportation, childcare, like family-friendly workplaces, and bringing together those stakeholders and looking at the gaps that we have and coming up with a plan to address those gaps.
So out of those that you just mentioned, which is the largest? I mean, have they been ranked? Is it, to what you need the most? Is it transportation? Is it housing? Is it, what is
There isn't really a ranking order. I think it's really subjective to like the county and what they feel their focus area is. And so for us personally, we are kind of focused on a little bit more of the housing and transportation side, because we feel like that's a really big challenge for us. But there are a lot of like food and childcare efforts going on right now. Gosh, I made a list of all the different food resources that we have, and we have like 27 or more than that just in Montezuma alone. So we are kind of pushing a little bit more effort into the housing and transportation side of things. And I had actually sent you an email regarding housing and transportation roundtable. And I was also trying to reach out to other leaders, government and other stakeholders in those
So with the transportation portion of it, what do we do to utilize our local transportation, as Jennifer was just in here? I mean, they provide transportation really for everybody now. Obviously, it's within a specific time frame of the day, but that basically gets people for stability of work and or whatever they need to go get within the day. Is that part of this program? Are you guys communicating with what our local resources are specifically?
Yeah, so for that specific strategy, it's really just bringing together the stakeholders so we can talk about what's currently being done, to look at what we need, and then to make a plan to address those gaps, so we can better support families and individuals regarding housing and transportation. So there's a lot of conversational pieces happening. I don't know if that answered your question
I think
at all.
it does. I think the component that's missing is that a lot of people, from what we see, is that a lot of people don't realize that MoCo really has that big of a ridership and can serve a lot more population.
And maybe that's obviously a gap that needs addressed, and maybe that's an action that we take from that conversation. Like, how do we get the awareness out about this service? So ideally in the strategy, there would be 2 to 3 policy recommendations that would be made that we could implement that would better support stability around housing and transportation.
Commissioner, is your mic on? People on YouTube are having trouble hearing you.
Yeah,
Okay.
green light's on.
Okay.
Better?
I'll find out.
Shaq, would you mind
We'll
going
change
back
it.
to the previous slide? Okay. Okay, so moving on to the next pillar, lethal means safety. This pillar is really focused on education around just making sure people know, like putting time and space between a person in crisis, person experiencing suicidality, and the lethal means will actually help reduce the risk of suicide. So this does include the Colorado Gun Shop Project as a strategy, which is really, it's a really unique project that was actually developed by the New Hampshire Firearm Coalition, where the gun shop owners, firearm advocates, came together and decided they wanted to start providing messaging around safe storage, a lot more messaging around safe storage and like suicide prevention. And so we would love to implement the gun shop project in this community, and we're looking at other partners that might be willing to take on that work. So we have reached out to like the DAV, and we'll probably be looking at a few others if they decide they don't want to take that on. But we think that it's really important. I think, 50% of all suicides are by firearm. And in Montezuma County, it's actually higher than that. It's 60%. So I think that if we can provide that education and keep like making sure we're passing out the right information, we can help reduce that suicide risk. And it also, this lethal means safety pillar also involves like prescription take-back location, like making sure to promote prescription take-back locations and events, and other things along that line. The next pillar, access to suicide safer care. This pillar is actually specifically the zero suicide model. So it's really the healthcare system side of suicide prevention and intervening when somebody is experiencing like suicidality. Like I know the Access Health System, they have a screener that screens for depression, and there'll be an intervention if somebody is showing for that. So we're trying to get that a little bit more widespread in our healthcare system here. We're trying to encourage our local providers to attend the Zero Suicide Academy that's coming up so they can learn more about it and look to implementing that in their own organizations. And then the last pillar is the post-vention aftercare pillar. And this pillar really has strategies related to what happens essentially after a suicide occurs or an attempt occurs. So these strategies in this include developing a community post-vention plan, working with the county coroner and other stakeholders that would be like involved in this work, to like make sure that they know the proper protocol and like how to get those survivors of suicide loss or those attempt survivors connected with care. Okay, moving on. And I just want to say, so we are the only state in the U.S. that's implementing this work, that is implementing this model because it's a brand new model. We are the only counties in Colorado that are doing this work. And of course, we were selected because of certain criteria, but we still get to have the legacy of contributing to this body of knowledge. And in that, we are also working to build a stronger infrastructure for suicide prevention in our community. So I think it's still something of note, like we're contributing to something greater. So our role in the CNC here in Montezuma, in a nutshell, is really like we are here to build a coalition, build an effort of stakeholders that are interested in preventing suicide, to look at the gaps and the supports that are needed and to create a plan to fill those gaps.
So if somebody's interested, what should they take as a step to be part of the process?
Yeah, I have my contact at the end of the slides. And I'll also talk about a couple of the work groups that we've got going on with the SAFE Coalition. We also support local efforts, and wherever applicable, we will do our best to channel some state funding towards those efforts that are already happening. We do have a mini grants bucket for community partners to tap into for events or one-time projects that would be in support of any of our strategies. We're also doing our best to provide trainings where we can, and I'll talk about one later today. And of course, other efforts that we're supporting. And then throughout this, we're doing a lot of data collection. There's so much data collection that we have to do. We have 95 indicators that we need to at some point be tracking all of them. And we have 27 strategies across the 6 pillars that we have to at some point be doing all of them. So it's kind of a heavy lift. We are very grateful to have established a data work group, and we have 2 individuals that are just really well versed in data collection, and we're very happy that they decided to help us out. But just stating the fact that there's a lot of data collection that's involved in this, because it is very data driven. This effort is very data driven. We want to make sure that we are focusing on the right populations, and we're serving those populations, and that our efforts are actually working. So, next slide, please. So, next slide. So the SAFE Coalition. SAFE stands for Suicide Awareness for Everyone. We just, at our last meeting, announced our name after about almost a year of meeting. We started meeting as a group in July of 2020, and our group includes stakeholders from government to to public school system, to community members, to the hospital. So we have numerous different, we have a lot of representation on our group, which is really great. And we have about 15 to 18 people that regularly come to our monthly meetings, which for a small county as ours, I feel is like a pretty good number. And the fact that they're pretty regularly makes me very happy and very grateful that they take the time, and they're very invested in this work. And in November to December of last year, we also established the vision, mission, and values of the coalition, which I didn't include in here, but I do have some documents that I'll pass on to you guys. And then we've most recently been working on developing a strategic plan, an action plan, which will hopefully be wrapping up at our next monthly meeting in July. And then going forward, from August going forward and beyond December, I guess, we're going to determine some work groups that would be helpful to implement the selected strategies that our coalition picked, and the actions that we need to take to support those strategies. And we'll be activating those and, of course, implementing the action plan. And again, throughout all of this, we are doing data collection and evaluation and plugging in those pieces wherever applicable. So next slide. So for the community, for those watching here today, we are looking for some data work group members. We need about 2 to 3 more. That would be really fantastic. And those work group members would help us analyze local data regarding suicide, amongst other things. But we have 2 people right now, and they're very great, but we could probably use a couple more. We do need to establish a postvention work group. This is the only work group that's specifically outlined in our suicide prevention model. And this work group would help in developing the county postvention response plan. And then, of course, we have, so the Behavioral Health Action Team is actually an action team underneath Team Up Southwest Colorado. And we found that there was a bit of overlap between their group and our education and awareness pillar. So they have very generously said that they would be willing to take on some of our education and awareness strategies. So if anybody's interested in participating on the Behavioral Health Action Team, you'll also be contributing to the suicide prevention efforts for Montezuma County. Moving along, supports. Okay, so this is kind of some asks that I have of you gentlemen. So very recently, we had our community partner, Celebrating Healthy Communities, express some deep concern, or Bria from Celebrating Healthy Communities expressed some deep concern around our agricultural community, especially with the drought that we're now in the midst of. And she had done some research and found that in drought years, we tend to have higher numbers of suicide. And I don't know if that's necessarily tied to the agricultural community, but we do feel that it might be wise of us to focus some awareness messaging towards the agricultural community. And so with this other regional behavioral health group, we are purchasing a bunch of we'll be purchasing a lot of awareness messaging materials that are more targeted toward the agricultural community, and we'll be pushing those out. But we'd love if the county would be in support of like helping us push that message out a little further as well.
How do you plan on pushing the message?
So there's some radio ads that we're planning on maybe putting on KRTZ and American General Radio, which I think is 3 different stations that are, I believe are more rural targeted. And if that's not true, well, feel free to chime in and tell us what is a better radio station or method to channel this messaging. But we're going to be printing like posters, flyers, and try to get those just hung up wherever we can, hardware stores, anywhere we can that we think that population might frequent.
So I would suggest IFA, Big
yeah.
R, Basin Co-op,
Yeah.
John
Cortez.
Deere.
Cortez Livestock.
And have you guys sat down with Dana and Vicky to go over a public outreach strategy?
I haven't yet,
Okay.
but I can, and I
I
will.
think that's one of the biggest places that we fail. It's very difficult to reach our agricultural community because they're out working.
Right.
They don't do a lot of social media, public events, so on and so forth. So it's difficult to reach them. So I'm glad you said radio because they still do listen to radio, which is critical.
Would that be the correct radio station that we should utilize, or would there be a different one or
I
better
think
one?
there are several out there. The ones that you mentioned are probably the largest, but there are still several radio stations out there that, could run ads at different times of the day to actually reach
There's a
people.
couple of them have ag shows in the morning and ag reports and stuff that you could combine right into that time that people tune in every morning to listen to.
Okay,
A
yeah,
resource for you might be Farm Bureau. They might
The Farm
do some
Bureau.
work on this.
okay. Thank you for the suggestions, and we're really hoping that this will be kind of like a gap fill between now and August, I believe, is when the end of our funding, is the end of our funding, but the state agricultural department, I know that they're going to be doing a lot of messaging too, assuming they get the grant that they had applied for, they'll be doing messaging in August, starting in August.
One thing you could do to take some pressure off the ag community is provide them with some rain.
Yeah. It's funny because we were doing the mural, we sketched it out on Friday night, and it just poured. It poured at the fairgrounds, and I told Jonathan, the artist, I was like, all we have to do is schedule a bunch of murals, and we'll just get rain by that logic. But yeah, it's a dire situation. And Bria from Celebrating Healthy Communities has been very much an advocate for getting a little bit more of this mental health messaging out to that community as well. And we were already kind of thinking about it with our behavioral health group because there's a campaign through the Colorado Crisis Services that's targeted a bit more at the agricultural community, and now that's just kind of solidified it.
And another partner you might have with that A lot of farmers and ranchers don't go to traditional doctors a lot, but they'll see chiropractors a lot.
Oh, interesting.
Come forward.
And you might have been going to say this, but I was wondering about the Cattlemen's Association and the cowbells. If you would have a connection for us so that we could, I mean, we'd even come and present to them. I think that would be a really good way
The
to.
Cattlemen's will have a summer picnic coming up here pretty quick, and they would,
We wanted to kill them with suicide prevention pieces.
Well, I think it's a really good prevention message to, because, I mean, with our community and what we're facing with the drought, it is, you know, people are going to be stressed. They're already stressed. So, you know, if we can get on the front end of this a little bit, it would be really beneficial. So, anyway, sorry.
Yeah, she jumped. She jumped ahead for me, but I appreciate it. I appreciate it. So it segues me into the next piece, the comment. Can you go back one? Thank you. So the comment training for trainers. So Shak, I think you attended the comment back in 2019. And I think that was just a training. It wasn't a training for trainers, was it?
It was a training. I don't think we did training for trainers.
Okay. So COMET stands for changing our mental and emotional trajectory. And this training is really like the way that the trainers described it, or the creators of this described it, is it is a non-clinical QPR. So it is a more conversational approach to talking to somebody about their mental health and helping them get connected with care. So and this could be a completely off-base assumption, but we figured that maybe this training would be more easily accessible to the community that is more susceptible to suicide, which is middle-aged men. So older and middle-aged men, our agricultural community. So it's less intimidating. It's more conversational. And we are providing a COMET training for trainers in August. We just set on a day and time with John Parker to have the training hosted at the Annex. And we really wanted to target the middle-aged and agricultural community to see if there are any leaders in that community that would be willing to become trainers for this COMET training. So that's a lot of words, but I wanted to tap into you all to see if you do have those warm connections that we could make with like the Cattlemen's Association, that we could find some leaders that would be willing to take this free training for trainers. And the training itself, in both regards, is only 90 minutes, and there's like a meal piece that usually comes along with it, and we would offer support from our side as well, and like coordinating and whatnot. So I wanted to put that out there. I don't know, and perhaps we are off base. Maybe that wouldn't be the population that would utilize that. Not certain until we try.
Well, it's really hard to tell until
Yeah.
you try. I mean, it's hard to specifically say who would or who wouldn't come to the training. I can probably tell you in our agricultural community from what I know about it, and Joel can probably speak to it better than I can, but to get anybody in right now with trying to move the water that they do have and take advantage of it for as long as they can, you're probably not going to get anybody because they're working from daylight till dark. So 5:30 till 9 o'clock at night. It's really hard to work anything else in through these summer months of the year. I mean, they don't have the time to come in. So I think your targeted training is going to have to be after all of the harvests are done in October, the end of October, early November maybe, where things change. And that's just what I see. They don't have time to add one more thing into what they're trying to do. And specifically through the drought, trying to take advantage of everything that they possibly can.
A lot of
Thank
those
you.
folks are out there monitoring their water almost all day long.
So, just letting you know that.
No, I
think we
appreciate
can
that.
give you
That's the kind of feedback we need.
the the contacts, but you have to figure out how to get them in here and
Right.
when you could actually do a training with them. Like Joel said, the picnic that they have reaches some, but if you're really trying to reach them all, the messaging through radio might be the better way to at least get them to where you can set up a training later on.
Right.
And if you want to have a special training, I agree, in the fall after the harvest
Okay.
is done is a good idea.
Yeah,
And,
November, 1st of December.
I would,
Gotta be
I would rent one of the community centers
Yeah, I was
And-
thinking Louis Areola.
and invite, we could have different department heads provide a chili dinner or something, and we could invite the Bar D Wranglers over to play. You have a better chance.
Any way to
Flyer
incentivize.
or a mailer too.
Yeah.
Get them to the mailing lists on like the Cattlemen's Association
Mhm.
and stuff and get it out there.
Great. Thank you for your feedback. I really appreciate that. So it's not on this slideshow because I just updated it, but I do have I don't have colored version, but I can send you the pictures and you can pass them on, or you guys can take a drive over to the fairgrounds to see the mural. It's really bright. It's not huge.
It is up.
It is done, yeah,
Good.
yeah. And the kids, we had mostly the 4-H kids show up. We did have one kiddo from the Pinion Project show up, but tend to lose people as you go through. The longer the event takes to happen, I think you tend to lose people, but the kids were great. They did an amazing job, and they were really excited about it. Yeah, so I can send that to Shak, and he can pass it on to
We
you
can
guys.
take a drive.
Or you can take a drive.
We'll take a drive.
Yeah, you can take a drive.
It's
Get out of
easy.
the office.
Drive, yeah.
And then I just wanted to say, Commissioner, thank you for your comment earlier about the veterans. I think in your position, you guys perhaps represent the population that we hope to target. And your voice carries really deeply into our community as commissioners. And so I just want to say thank you so much for stating what you did earlier, because it means a lot, and it helps to change the norm around seeking help. So I think the more that our community hears you all advocating for seeking help and reaching out, the more influential it'll be, and the more people will help.
I have one question. You're going to start down this road. How are you going to protect the people in your group? Because there is a mental side to this, and you will pay a price.
Right, yeah. That's a really great question. And I think I need to think on that a little bit more. And I agree, like, we need to make sure to protect the people that are doing this work too. And like, I'm a part of that. So like, I'm trying to make sure to take care of myself as well.
Right.
But I think it's also important to vocalize that we all need to take care of ourselves as we're doing this work.
Your employee assistance program through your health insurance provides some resources for
Yeah.
that.
Yeah, and I appreciate that resource. And, you know, I did reach out to our state coordinator a while back, and I asked her if there was any way we could include like some sort of funding to help support to make sure that on our side we're supported as well as we're doing this work. And I never got a response back, but I will but I will follow up with that, and I think it's important to have that reminder. Thank you. Do you guys have any questions? I can pass that. It's kind of black and white, but
I've asked mine.
okay.
Sorry. I've asked mine as I went along.
Yeah.
So.
Okay. All right, and I'll pass it along to Katie. Katie Maxwell. Yeah.
Okay, thank you. Good morning, Commissioners. Good morning, everyone.
Good morning.
I'm a little taller. Yeah. Okay. My name is Katie Maxwell, and I recently joined Arlena as the co-coordinator for both our CNC and EFC programs in April. And I'm from Mancos, so I just want to say I appreciated all the Blue Jay pride that was represented here last week in discussion of the mural.
You know, you guys in the audience could grunt an amen when she preaches that.
Thank you. Okay, so let
Well,
me see.
there are some
We've
things
got-
that we need to work on. but
Yeah.
always a
MCHS
work
and
in
Dolores High are
progress.
gonna have to
I
step
can
up.
see there's a little bit of rivalry here. Okay. All right, so let's see, next slide, please. Okay, so I'm just going to tell you a little bit about our EFC program. This is a much briefer presentation. The majority of our work is the CNC suicide prevention, but we also do this work, and it's no less important. So I'll tell you a little bit about what we're doing now and where we are planning to go in the future, and then if you have any questions, we can go over those as well. Or feel free to ask during, if you like. Okay. So next slide, please. So EFC stands for Essentials for Childhood, and the primary goal is to reduce child abuse in our county and support parents and caregivers in raising healthy children. So Arlena and I specifically are focused on increasing economic stability. And as you might know, high rates of economic insecurity lead to high rates of child abuse. So we want to help support families as much as we can to prevent that from happening. So obviously increasing the economic security helps decrease the child abuse. That's the goal. Next slide. To this end, we have been working to learn what barriers there are for people in Montezuma County to getting help from programs like WIC, SNAP, and CCAP, which help supplement food and child care expenses. There are an exceptionally high number of Montezuma County residents who are eligible for but not receiving these benefits. So earlier this year, before I came on, Arlena did a bunch of interviews with people who have experience accessing these programs to find out what the barriers and challenges are and if they're experiencing any sort of stigma when they try to access these programs. So those interviews were very informative, and we'll be using that information that we collected to create an awareness campaign and other outreach efforts in connection with our community norms partner through Team Up. And we have a couple of groups that we're working with. You might remember the youth that came and presented on child maltreatment. We work with them. Also, the early childhood education expansion team. So we are all collaborating together to kind of increase visibility around this. Next slide, please. We are also working to increase the available childcare slots. So we have a pretty big shortage of childcare slots in the county. So together with the action team,
Is that like a small closet where you stick children? A child care
you
slot?
could call it that. It's pre-K and daycare childcare slots. So any spots that kids can go to.
Okay.
We are also, we determined that there are 977 slots needed. So that's how many we are short. That many kids need somewhere to go. So we are working on efforts to help kind of increase those slots, and a couple of those ways that we want to do that is to help people wanting to start childcare centers. So we're going to help with mini grants to people who are interested in starting, and also paying for things like fingerprinting, just to kind of get the first steps rolling and make that more feasible for people. Okay, next slide. So that's pretty much the brief presentation on that and what we're working on. We're really excited about all of the work that we're doing, and we do appreciate your interest and your support. Do you all have any questions?
The need for childcare, those 977 slots, are those, that's all the kiddos 0 to 5 or whatever?
So that number came from 2020, and that is 0 to 5, the children that would need childcare. And that number has not shifted very much since, 2019. That's not shifted very much
Are
at
those
all.
all unmet, or lots of those are met and we need to meet the rest of the needs for that 977?
So that is the gap in childcare that we have. So we have,
They need
we need 977. And to be fair, not everybody's going to utilize childcare. Like, they may just be stay-at-home parents and whatnot. But, you know, like, even just speaking with our WIC manager, she said maybe like a quarter of those. And even a quarter is still like a pretty big number. And I think the biggest gap is in the infant slots, like super, super young.
Do we have a
or-
lot more infants now that people were first forced to quarantine for a year?
You know what? I've asked this question, and I think the
granddaughter.
consensus is yes, there will be more babies like coming. How much, I don't know, but I feel like there'll be more coming.
So do you have
And so
anyone
do you
interested in opening some facilities, or?
There are a couple, yeah. There are a couple that have already connected with the Montelores Early Childhood Council, and they're in process. Like, I think there's possibly one going in Mancus, and I think there's one other one that's interested, but I don't know whereabouts they're planning on putting it. But a lot of, so like, in terms of increasing childcare slots, we are looking at what's called family, friends, and neighbor care, and that's like somebody doing childcare out of their home, not a family child care home. There's a lot of different names for it, but this is more informal, like it is a family friend or neighbor, and they are able to be paid, like reimbursed through the Colorado Child Care Assistance Program through CCAP. But just to throw a number out there, only 10% of the eligible the people eligible for CCAP utilize CCAP. And I think it coincides with the fact that we just don't have slots. Like, if we don't have slots, they can't utilize the benefit, and a lot of those slots are not CCAP eligible. Like, we have a very small percentage of CCAP eligible slots. So. Any other questions? And this work really falls in alignment with the economic stability and supports pillar of the suicide prevention model, which is why they put these two grant pieces together for these roles. We got a lot of work to do. We got a lot of room for growth, is what I like to say.
It's, the economic stability component of it is obviously if you need childcare, you can't go to work and get a job, but there are a plethora of jobs out there available, again, to anybody and everybody. So, it's a tough situation. I understand it, but
Yeah, and childcare expenses are, like, people have to decide, do I want to go to work and just pay for childcare, or do I want to stay home and save more than that? So, there's choices to be made.
all right, thank you.
Great, thank you, gentlemen.
Appreciate it.
Thank you.
And I'll just leave these like summary sheets with you guys as well.
And we'll take a drive here pretty quick.
Thank you.
And we'll go out to the fairgrounds. Thank you, guys. Okay, social services, we'll go back to the top now.
Good morning.
Good morning, Lori.
Paperwork.
Gonna take care of this right away. One of you guys? We'll do
Yeah.
the Record and pay.
Yeah.
Okay, gentlemen, if we'd like to look at the records of proceedings, if one of you would like to move that forward, or do you have any questions or comments on either?
No, I move we approve the record of proceedings for the County Board of Social Services that met in regular session Tuesday, April 26, 2021.
I'll second it.
Okay, it's been moved and seconded to accept the record of proceedings for Montezuma County Board of Social Services, which met in their regular session Tuesday, April 26, 2021. All those in favor?
Aye.
Aye.
Aye. Payables? Any questions on that, gentlemen?
No.
Here's April.
I move that we pay the payables for the Department of Social Services for May of 2021 in the amount of, says May on there.
I've got April on your screen with the amount highlighted.
Okay, well, I got May on mine.
There should be two.
That's okay. If you look right at your screen, I've got April up with the amount
Okay.
highlighted.
For the month of April in the amount of $1,629,709.22.
Okay, and now I'll pull up May for you.
And also in this motion to pay for May for $1,554,882.95.
Second.
Okay, so it's been moved and seconded to accept the payables for the month of April in the amount of $1,629,709.22, and the month of May in the amount of $1,554,882.95. All those in favor?
Aye.
Aye.
Aye. Okay. All right, now that that's done, Lori.
Gina asked me to present the memorandum of understanding. I think it's in your packet there. It's for the Colorado Works contract between the state and the county.
Okay. John, have you had a chance to look this over? Has it changed or?
I don't know the answer to that, whether or not it's changed. It looks like, and I don't recall this, that these are 3-year MOUs, but
They started
we
3
sign
years.
some sort of amendment every year is what it
Right.
says.
Correct.
And as long as social services understands what its responsibilities and duties are, you know, I don't have any objection to it. Basically, to sum it up, it says that this is what's going to be done, and if we don't do it, the state will take it over.
Basically.
So if we don't do it, they'll
Which
do
we
it
are
for
audited
us.
The
on all
state,
the time.
the state is paying for all of it anyway. We're just providing the facilities, basically.
Well, actually, the maintenance of effort is the county's contribution. But we can use that money to help for helping people that aren't actually able to get onto the system. Does that make sense?
Okay, you guys, gentlemen, any questions?
No, the term of this MOU is from July 1st, 2021 through June 30th, 2024.
Mm-hmm.
And be reaffirmed annually. So I move we sign the memorandum of understanding with the State of Colorado Department of Human Services.
I'll second that.
Okay, it has been moved and seconded to sign the MOU with the Colorado Department of Human Services and the Board of County Commissioners, Montezuma County. All those in favor?
Aye.
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 That was easy, huh?
That was easy.
Spending tough money.
She's got it assessed that way. Okay, that's it? All right. Okay, Jonathan. Senior Services.
Not a whole lot going on. Obviously, the big thing is the floor. You know, that's the new thing over there. That better. The floor looks great. They were a real professional crew. They just did an outstanding job. I know they were from Albuquerque. I talked to them a little bit, but just a heads up, they were straight up professionals. So I mentioned this to Shak yesterday. Whoever picked them picked a solid company, that's for sure. It looks great. It just looks great. So we've sent out a little notice to everybody to come by and take a look at, basically, it's a new center. If you look at the whole annex from our side of it, from the senior center to the annex facility that's rented out, I mean, it's night and day from just 2 years ago, really a year and a half ago. So I think the people in the, in the county need to come by, take a look, or just know that things are being done. It's really, the change is dramatic. It's really drastic change, so it looks great. So I think again, the folks in the county can be very pleased with it. Really good job. Just a few small things. I think I mentioned at our department head meeting that we added a day to the Dolores site. They've been 2 days since I've been on, and I think forever they've wanted a third day, and it was just a matter of timing and budgeting, and I think it was a good opportunity. So now they do 3 days a week. We have a new gal out in Mancos. She's a local resident who's lived there her whole life. The two that were there, one retired and one went to care for family. So we kind of got fortunate there. She's a lot of experience cooking, great personality, and we're already seeing nice change over there in Mancos and positive change. So that's a real plus for for the senior center as a whole. So that's all looking well. Again, facility looks great. The sites are doing good. Fiscally, we're in a good spot. Budget-wise, we're good. And it's a minor concern, is food costs are up. They just are, yeah, and you know that from your business.
They're not up, they're way up.
They're way up. They really are way up. But in general, we're good, and it's not affecting us in any way. It's not limiting food, meals, deliveries, nothing like that. So we're in a really good position going forward. I see the new grant, the 21-22 grant up there. No changes. It was just simply a continuation grant, so there's no fiscal changes that I'm aware of from last year. I plugged in the same numbers for everything. Makes it easier, and with the way funding is with AAA, trying to change things, really, it's all you're doing is removing categories around, which I can do throughout the year anyways. So that's really about all I have. The big thing is the floor, again, which does look amazing. If you haven't seen it, come take a look. It's really nice and well done.
Yes.
So props to them, and then, again, we're good. So that's about all I really have, commissioners.
Well, maybe we'll walk over there before we take a drive.
Have you heard anything from CDPHE, Public Health, AAA, anything on, I don't know, when you might be able to have a salad bar?
For some reason, I knew this was coming up. I think we're all still shocked that I got $20,000 for a salad bar. Who would have thought, right? I'll ask Rocky Mountain Health again. So it is a great idea. That's for sure. So I'll work on it, Shak.
Okay, sounds good.
Deal. So nothing further from you guys.
Do this. I make a motion, we sign the San Juan Basin Area Agency on Aging contract.
I'll second it.
So it's been moved and seconded to accept and sign the San Juan Basin Area Agency on Aging
Hard to get out.
Contract between Montezuma County in the amount of fiscal year 22 grant award $136,082.79. All those in favor?
Aye.
Aye.
Okay, appreciate it.
Is, anything, have they announced any search for Tom Butler's position?
Oh, I have not talked with Christina Knoll, who is the director for the AAA, who oversees the entire, funding for our region. I have not spoke to her. We spoke actually just last week before, and I knew the position was open and they're looking for someone. I'm throwing my hat in if she's listening to the old director, Sue Fletcher. She would be a great advocate for us. One of the nice things about having Tom as the chairperson, AAA, their board oversees all of the funding for Region 9, which is 7 sites. They've added another site. And it's really critical that we get representation from Montezuma County. I mean, we all know, comparative in different parts of the state, it's oftentimes we kind of left over here in the corner. And so Tom's role was critical. It was really important. And if she's listening, if Sue Fletcher's listening, I'd love for her to move into the position. Sorry, Sue, but she would be great for us. And so I'm hoping it would be someone from our county. That would be ideal.
Yeah.
Yeah.
Can make a phone call.
Absolutely. So, appreciate it. Good enough? Thanks, you guys.
Thank you.
Appreciate
Thank
it. Yep.
Thank you, John.
Community Connection Shack, are they coming?
They will be zooming in. She's aware she hasn't made it to the waiting room yet, so we could move
Okay.
to our impromptu.
All right, well, then we have something that's added to our agenda. We have a special request draw, Englehart Road Bridge. Good
Good
morning.
morning.
Thanks for spending a few minutes with me this morning. I wanted to discuss the idea of possibly purchasing a middle-sized excavator. It's not a mini X and it's not an excavator. It's kind of that one in the middle that it's hard to get sized up to. But a little history on this: we had a rubber-tired excavator that the county had owned for several years, and it was huge. And we had a mower on the end of it we called the Terrorist, because it would, everywhere we went, we were in trouble with it. And it was big, and it was cumbersome, and it was hard to work on the roads, and so we sold it last year at an auction, public auction. And we've been searching for another replacement for it of some sort over the last year and a half. And so when Bonnie bought hers, that got our attention, because we'd been looking at these types of mowers. It's like, man, that's a pretty good way of getting rid of these limbs and trees and grass and sagebrush and everything along these right-of-ways. So we borrowed hers one winter, and it does pan out to be a good deal for us. And the mower type that she got, we like that fixed tooth type mower rather than a flail mower, which is something that we didn't want because it cuts only small stuff. So we played with it last winter, and then we rent all the time these excavators to put culverts in. These not mini X, not excavators, but this mid-size range fits culvert installations. We've learned to pull ditches with them, shoulder up the dirt onto the shoulders to widen the roads in these areas rather than hauling it off to landfills or wherever like the big excavators did. So we've kind of come up with a good idea here to use one machine for 3 different operations: mowing, ditching, and then putting in these culverts. So we've been working for about a year now on what machine fits us the best. So I went out and got a lot of information on Cat, Bobcat, John Deere, and Kubota, and we've rented all of them to test them, and with mowers and with buckets. And we've come to the conclusion that the one we like the best for what we do is this Kubota 80 series excavator, which I've got that picture up there for you right there. Now this is after a lot of testing with Bonnie's machine, Bobcat, and all this. So this machine fits the need for size, weight, hauling it. It's not too heavy, it's not too light. It can handle heavy loads, or it can handle that mower. But the most important thing we're looking at on these machines is this mower, what it takes to run it with the hydraulic oil flows. Now, out of those 4 big guns I just mentioned, only 2 of them can handle these mowers. The others are not set up for it yet. You can do it with a John Deere. If you want to wait to special order, it has to be built at the factory. Bobcat don't even offer it yet. So these 2, John Deere, Kubota, and Cat, zeroed down to those 2 is about our only option to look at for local service and dealers and reputable equipment. So with that, the mower is the second page there. That's what this looks like. It's a fixed tooth mower. This happens to be a FAE type mower. Caterpillar offers the same thing, so I just said, well, give me a price for an excavator and a mower as a package. Let's see what that does to us here. So I'll get to that here in just a second. These mowers are really good. We really like it way better than the one Bonnie has. Hers has a tendency to have little issues with drives, belts, and dirt and dust getting in places we don't want it to get to when we're doing this mowing. We've done a lot of mowing with this particular machine, rented it from Bobcat or Kubota, and that's a good machine there. That thing can mow, so, and it's done a good job. And we've been able to compare the 2, so this has been kind of a fun study. There's no guessing on this now. We've got this dialed into what we're wanting to be here. So, next page. This is what happens when you mow them, though. So it isn't pretty. It can be kind of ugly, especially on trees. The Terrorist wasn't any better. It was worse. So we got rid of it, but we will see this from time to time. So I don't want to give you a false impression this is the end-all problems. It's not. This mower will create damage. So basically, we've learned now with these crews, to go next picture, we either go behind the mower and fix it, or we go in front of the mower and fix it. In this case, they were behind the mower and didn't get it fixed till the next day. But this is how we try to leave these damaged trees as we go by. Brush, cattails, oak brush, we never get into a lot of problems with that kind of stuff. But these we do have to take care of. So no falsehood about it. It can still create some public relation nightmares at times, but we do take care of them by doing the trimming and the arborist work on them. A lot of times we try to get out in front of the mower so the mower don't even touch those trees. But this time of year, you can't mow live trees. I mean, cut them down and then grind them up. It just plugs up the grinders. So you got to wait till winter to do this. This you can do all year round. So with this mower. So and then the last picture there. This is the end result. This is up on Road W. This is where we're working down the right-of-ways and opening this up. Again, you can see in there's a lot of leafy material. There's a lot of oak brush along the shoulders there. This opens up for a lot of open roads. We can see through the curves. We've done hay camp all the way to the Forest Service. We've done Road W. We did all the mowing for this McCamel slide down there in that thicket of willows and trees with these types of mowers. And we actually tested both machines down at the McCamel slide and liked the Kubota better, so to be honest with you. So it is a good machine. So I'm here today to visit with you about purchasing a Kubota, and my spreadsheet there shows only 2 machines. The reason, as I already explained, the Bobcat and John Deere are just not available right now, or we would be. I had my eyes set on a John Deere 80 series until we found out it cannot mow, walk, and swing at the same time. It just doesn't have the oil capacity. Kubota doesn't have it fixed yet either. So when you look at your 2 options in, Southwest Ag out of Bayfield and Wagner Equipment out of Durango have the 2 best options. We like the Kubota for its weight. We're at about 18,280 pounds, which holds it on our smaller trailers. We don't have to have the big transport trailers, versus 21,000 for the 309 like Bonnie's, which is cumbersome. And you start doing culverts, it gets heavy, and it's hard on the shoulders of the roads when we're walking down them shoulders. Both machines are about equal in horsepower. You're a couple of horsepower difference, so that's not an issue. Same size working buckets. They both have a thumb. Both of them offer a swing boom with a house boom. So what that allows us to do is work one lane, pulling ditches or trimming or cleaning without closing a lane. Where before we had to have traffic control wherever we went. Whatever we did, we had to have traffic controller full time. Now we can just go down through there with some cones, put up a few signs and clean ditches or mow and everything. And if it's too tight to let the house swing, you just use your backhoe option to do all the work. So, and keeps us in our own lane there. So we like that option. The reason that Kubota can work here with and mow and do all this is they use what they call a three position selector. You go to your computer and you turn on mode 1, for instance, and that puts your oil to the mower, and it still gives you enough oil to walk and swing. So that's their way of doing it. Cat uses 3 pumps. If you look at Bonnie's, it's called a high flow. It's a 309 high flow. A 308's less money, but it doesn't have the high flow capability. So you got to bump on up to that next bigger excavator, which is just a little bigger than what we want. Horsepower is relatively the same, but the weight's a lot more. So it makes it harder for us to maneuver. We're looking at rubber tracks. They seem to be the most popular. We've tried both segments and rubber. We see a little bit more damage to the road with the segments. Not bad. I mean, they're rubber segments. You can change them over a track, but the lifetime on these rubber tracks for excavators is pretty good. It's 3 to 5 years depending on what you're doing. If you're not in a rock quarry cutting them up, they last a long time. It's not like a skid steer spinning circles on rubber tracks and tearing things up. So they're working pretty good, and they're less money. So our choice would be rubber tracks. So if you look at the mower on there, it's underneath FAE. We're not quite sure what's going on there. Cat has the same mower. They just put Cat on it. And we're not quite sure why there's a price difference there. We're researching that. But if you went with the package at Kubota, we're looking at $126,804. If you go with the package from Wagner, we're looking at $147,282. So our request with a mower and a excavator package would be to ask for the Kubota machine if we can make that work.
Question, gentlemen?
No, at least it doesn't go through and cut a big V out of the middle of your tree.
No, we didn't. we let the other guys do that one.
Actually, I have a question, Rob.
Yes, sir.
What were the funds received? What was the amount that we got on public auction for the old machine, for that rubber tired?
I'm hoping he answered me. Oh, yeah, we got 25,000.
25,000. So that obviously would go to the use those
It's in the
funds to
bank.
go to
It's in the bank. Yeah.
Yeah.
So,
Okay.
yes, sir. And we do have adequate funds in our capital outlay for this equipment without going any other accounts for it. So.
Okay. Questions?
Nope.
Comment?
No, it's just replacing a piece of equipment.
Old machine with the new machine.
Yep.
And a lot more options of use. We can,
Right.
you know, another thing that led us to push this a little harder was this lack of water. You know, what do we do now when we don't do what we normally do? So one thing
So-
is this work, you know.
Are you mowing the Russian olives out of the right-of-ways?
No,
they're
I
in the
haven't
right
messed
of
with
way.
those. That gets into Bonnie's world. I mean, I will if they're in our way.
If
but
they're
I-
in the right of way, you
Yeah,
would.
but I like Bonnie to do that. She's got all the chemicals to kill the trees and all that, and we just go buzzing on by. We just delay the inevitable. It's gonna grow right back. So when we get to those, we kind of lean towards calling Bonnie and say, hey, at least show up with some poison and we'll whack it out of there for you. But you got to have the poison there to help control the tree too.
Gotcha.
So we're a little tentative on that part, you know, only because of that. If it wasn't for that, we'd just be mowing it just like anything else. So, yeah.
And speaking of the water conservation, you're not blading dirt roads, you're not throwing out extra gravel, you're using mag chloride instead of water, and
Yes, sir, and we're probably going to not spread too much gravel this year at all. We got to finish Road 10, and we're keeping our fingers crossed we'll keep enough water to do that, plus chip seal it, because that's our DOLA grant. We want to make sure we don't lose that funding,
Right.
because if we don't build it, we don't get it. And so we got to do something there. Even if it means take every water truck we got and haul water from the city tap in Cortez. We got to finish the job. That's a $300,000, you know, grant.
Grant.
So, but, you know, in the big picture, what do you do with 6 belly dumps and 6 truck drivers? You go do hot mix repair, you go do shouldering, you go do this kind of work, you know, clean up, mowing, traffic control. In some cases, even though I don't like it, we still have to put traffic control out there on these things. So it's going to be a different year here for a while with the county road department, what we can do and can't do. So
Well, it's just a switch. I mean,
it is, and this is
there's
a
just
tool
lot
to
of
help
other things that we
transition to
can
it.
do.
So when it rains, you're gonna go out and get on what you can?
Yeah, let's
See what
define
kind of
rain.
moisture.
Let's define
No,
rain.
it's gonna
I like your optimism when it
gonna rain.
rains.
If it's a shower, no, you'll
Yeah,
just make it worse.
I mean,
But if
rain.
it's a 3-day soaker.
It's gonna rain.
Yeah, we'll have every blade we own out on a 3-day soaker. If we can get the moisture into the road, you bet you we will, so. But, you know, there's no reason to jump on a blade when it showers for 15 minutes and go blade a road. 'cause,
No,
Right.
you know,
that's,
So, no hopes, I don't wanna get any hopes up out there.
Some of it's so spotty, by the time you get there, it'll be dried out.
Yeah, I've had several retire under my tutelage and ask them, every one of them, would you guys work on weekends for me if you'd go out and, like, Goodman Point or out there in the drylands at Pleasant View and Yellow Jacket, somewhere out there, on weekends if it rained? Oh, yeah. You know, I've yet to put one of them guys to work yet. In all these years, we still can't seem to get that rain and weekend together, yeah. So, anyway. So that's my proposal. It would be a great addition to the road department for many years to come. We've got a good service department out of Kubota and Durango, or Bayfield, and they got good warranties on their equipment. And I think if you drive through the Durango, La Plata County area, you'll see a lot of orange out there, so they must be pretty popular machines, so.
okay. Any other questions or moving it forward?
I'll move that we authorize Rob to purchase the Kubota excavator from Southwest Ag, the tune of $126,804.
That includes more, yes, sir.
I'll second it.
Okay, it's been moved and seconded to purchase from Southwest Ag a Kubota excavator with a mower in the amount of $126,804. All those in favor?
Aye.
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 Thank you.
Okay.
Any other questions while I'm here?
How's our chip seal? You're gonna start that pretty quick. You said I don't have that calendar in front of me, but
Chip
the
seal
end of the
is
month.
still up in the air due to our, certain people out there that help on the other end. We still haven't got that dialed in yet. Paving does start Monday, the 28th, Road 29, Road N, and Road G. So they'll go through probably till the 15th of July, and that'll be done. So we're putting our public notices out this morning, getting signs set up, ready to go. So that does start Monday morning, so.
Okay.
Get that going.
And just for hopefully anybody out there viewing or listening, there will be restrictions on the county roads. Again, that was County Road G, 29 and N. So be patient and not that there are a lot of,
Don't drive through the oil.
not a lot of alternate routes, but there will be oil on the road and then new HMA. So be cautious, be careful, and pick an alternate route if you see these crews out there.
Yeah, Four Corners they're real good. They'll have high alert traffic control with them. So they're real good at moving traffic through, but there's still going to be some delays, just like all paving, so.
Well, I just know that County Road 29 is getting utilized a lot, along with M and N, because of the situation in
Right.
town that's going on right now, and 145, that main intersection where they're getting bottlenecked, for 10 minutes. It's I just trying to warn the public that the 29 road is now going to be also tied up for a while.
At least
So-
we're north of M, though. That helps. They come up to M and go back towards the west to 145. So we're north of that.
Right.
That does relieve a little bit of that
Yeah.
pressure
Right.
up there. So, yeah. But you're right. It's a
It-
busy road, so.
It is just going to create, so before we start getting all the phone calls, and don't,
Yeah, and Four Corners, their schedule does not have them working on Monday after the 4th. It's Sunday, so they're off on Monday also. So no paving operations, basically Saturday, Sunday, or Monday. They'll pave Friday, but then they're off till Tuesday. So then they'll pick back up, finish up there, then head for OG.
okay.
And that Road 29 north of Mary, that's your district. You're the one that should get the calls, right?
I think I get them all.
Okay.
Even
That call
in,
forwarding stuff is pretty good.
yeah.
Looks good.
That
I
call
think-
return works pretty good too.
Yeah, I think that call forwarding is working very well. All right, thanks,
All right,
Rob.
Thanks.
Rob, I'm gonna grab you.
Okay, Community Connections, Shak, I see somebody here on Zoom.
Yes. And you're still muted. There you go.
Hi, good morning. Can everybody hear me okay?
Good morning, yes,
Morning,
ma'am.
Thank you.
Excellent. Hi, I'm Tara Keene, the President and CEO at Community Connections, and thanks so much for letting me join remotely this morning. It's the end of our fiscal year and things are intense, so a lot going on, but we definitely appreciate the time on the agenda. Really excited to share that our Pine Street Day program opened back up in May. And people, of course, were super excited to start getting together with our friends in person again. Some of the time off gave us a little bit of time to revamp some of the ways that the programming occurs. And we have a lot more client leadership. Some of our clients had stepped up to actually lead some of our virtual classes and wanted to continue that leadership. And so we're really excited to see our clients really kind of taking on that leadership role within the programming. So that is really fun and exciting to see amidst all of the weirdness that we've had in the past months. We also got permission from the state to start allowing our case managers to do face-to-face contacts. So they're really excited to start meeting directly with clients. A lot of them had been having to do meetings over the phone and virtually because they just weren't allowed to go into homes, but we now have plenty of protocols in place and they're going to be able to start being face-to-face. So we were really relieved to see some return to normalcy and normal programming. Some people are a little bit more hesitant to come back to the normal state than others, and we're just trying to meet people where they are. The other exciting thing that I have to share is that we are gearing up for our second Festival of Reeds in Cortez. We're really hoping to light up the kind of downtown strip on Main Street. A lot of great supportive businesses this past year, and hoping to light up the town with some reeds and kind of a celebration of the season and celebration of hopefully being past all of the difficulties by then of the last year and a half or so. So really excited to get that going. Got some businesses that are already stepping up and getting that going. And then we just really wanted to thank the county commissioners in Montezuma County so much for your support this year. It's been really rough for us, as for many people. There were a lot of changes that had to be made over and over again as the situation changed, and to meet client needs while also keeping everyone safe. We started this last year looking at a $600,000 deficit, and we are pleased to be coming out with more like a $250,000 deficit. So way better than we had expected. And it's really been, generous donors and our local governments like Montezuma County that are really keeping us going. So we really, really appreciate your support and getting us through, and hopefully heading into a new fiscal year on July 1st that is going to be, a little less depressing than this past year has been. And I think that's really all the major updates I have. If there are any questions, I would love to field them.
Tara, now that you're kind of returning back to some sense of normalcy, how is the morale among the clients that you work with?
They are just excited to be back out and doing things. I think at this point, they are used to all of the protocols, all of the kind of being careful, washing your hands all the time, the masking. They're just glad to be back together. So it's, I think, really been nice to see just the sense of relief of, yeah, let's get back to normal. Let's get over this thing. Let's start things afresh. So I think the morale has definitely been really positive, really high.
Very good, gentlemen. Any other
Sounds
questions or
really
comment?
good. I'm glad to see you guys are back, face to face.
Yep,
And
us
opening back
too. Most definitely.
And you have a program where you help some of these adults that are developmentally delayed, but they are able to do tasks to find jobs. Is that a program you guys are still working with? Because I know virtually every employer in the county is hiring.
Yes, absolutely. And so we would love any employer that is looking for folks to give us a call, because we definitely have some people that would like to find a job.
Okay, great. And where can they reach you? What number should they call?
Probably the easiest thing is just to call our main number so they get directed to the right person. And that's our 970-259-2464.
259-2464. Okay, and that's Community Connections. Okay, great, thank you.
All right, thank you, Tara. I appreciate your time, unless the commissioners have anything else.
No, thank you very much.
Thank you.
Yeah, well, thank you
Appreciate
so
it, and
much.
good luck moving
Have a lovely
forward.
day.
Thank
Yep.
you.
Bye-bye.
Bye-bye.
Okay, John is out. James told me this morning that he had no report. Actually, we have unfinished business. Sorry.
So
that.
I just wanted to give you guys a brief update on the dispatch IGA. We had, of course, the sheriff was in here last week, and he had asked you all to hold off a couple of weeks and see if we got some numbers. I did want to let the commission know that I do have preliminary numbers for next year from the from the city administrator, and I'll be going over those with him and getting with him later this week just to make sure I've got a full understanding. But I did want to let the commission know that we have received numbers as promised.
So if the numbers are all to where they should be, or where we'd like to see them, then we can go ahead and sign that next week.
Correct.
Okay, good. So that was great. Thank you to the city, or the new manager and their new I guess it would be their chief financial officer, CFO, for getting those numbers to us that we had asked in our workshop last week. So I do appreciate that. Okay, we'll go to Mr. Baxter then.
Yes, so this road complaint, the new road complaint we have, we're gonna file our answer to that on probably Friday, probably this week. That's what I was actually just talking to Mr. Engelhardt about. He's not named in this one. This is a lot different than our Weber Canyon case in the sense that it's a deck action, which means that they're just asking the court to declare what is this road. Obviously, it's very important to the owner, or he wouldn't have gone and hired a big firm in Denver to do this for him. I'm confident it's a county road, but obviously there's some confusion and some issues. So we are meeting with, I think, Doug and James this afternoon, and that action will get going. And after we get our answer filed, the court will probably hold a status conference and start setting dates and figure out where it goes. They're not claiming damages or anything like that. They're asking for a court order saying, what is this road? They claim it's private. The SRS funds, I think it was Commissioner Candelaria that asked me to revisit that statute, and then I think I only emailed Commissioner Candelaria back about this, but that statute, and obviously it was, we haven't looked at it in a while, but specifically states that the funding we get, 25% road, 25% to the public schools, not to education. We were interpreting it broadly, thinking education, but it actually is very specific about public schools. And then the other 50% is discretionary for the county commissioners to decide how to distribute that to the road department or the public schools. So,
Go ahead.
no, I am curious and welcome anybody's input. I mean, one thing that dawned on me when I was speaking with Commissioner Candelaria about this was, as far as negotiating and you all deciding how to use that, while the funding, it looks like statutorily would have to go through the school system, you don't have to give any more to the school system. You give all to the road department, and perhaps a negotiating tactic could be say, hey, this is part of education, public schools, school district, will you help fund what we wanted the money to go to? And if so, maybe we can, give you some of this money and you take some and fund what our desires are, because maybe that's a win-win. They get some, and you can still direct it how you want it directed, because you don't have to give them any of that 50%. The statute does suggest that you should meet with them. I know we haven't met with them every year. We have the last 2, I think. I'm not positive about that, but to hear them, they don't dictate where it goes. You all do, but you've got to hear them.
We did have that conversation in our workshop yesterday, and part of the issue here is, I don't know if Dolores has a new superintendent.
They don't. I reached out to Liz and she's still
Cortez,
there.
I don't know if they have a new superintendent, and I think we just
Mancus
established
did.
that Mancus is the
And I've been
only
in
one
touch with Mancus as well.
that has
so
it. So
the only one I
basically
have
we
to follow
directed
up with is Cortez.
Shaq to get them back in the room. We can have our conversation with them, and then basically go with your recommendation of distributing that into what we've desired for early childhood education. So I think that's kind of the tactic that we're going to go with right now. If we can get, hopefully, these superintendents, whenever they get on board, or their designee, as it states here, into the room so that we can have the conversation.
Right. I mean, it certainly fits with the spirit of helping education.
Right.
Right. A couple more things. Oh, we did receive that, our residence case, which 2 of you commissioners, the shed, which 2 of you commissioners were not involved in. This lady testified that she lives there, she sleeps there, and the law does state that, and I don't know that that's true, but it's a shed without running water, without a bathroom, without electricity. She stated that they have a solar array that they use, a portable toilet, and sleeping. Now, those things do not meet our land use code, but the the statutes require the Board of Assessment Appeals to treat the land for what it is actually used for. She says that she lives there, she sleeps there, and so they directed Ms. Bugg to change it back to residential, which is another big thing they counted, they relied upon was the two former assessors, both of Ms. Bugg's predecessors, apparently told this woman in writing, if you put a shed on the property, we will change it to residential. That is not how it should be. That's not the law. I endorse Ms. Bugg's interpretation of no, this is vacant land, this is not a residence. However, that's what the Board of Assessment Appeals conclusion was. The Board of Assessment Appeals isn't a court. We can appeal this to a court and I think likely get it overturned. I think that it's not necessarily, her testimony wasn't consistent with factually what's on the ground. There doesn't appear to be anybody living there. It's overgrown with weeds. It doesn't appear to actually be used for residential purposes, which does contradict what was presented to the Board of Assessment Appeals. So you can appeal it. I don't know that it's worth any of that time and effort for one property. It sounds like it's going to be sold anyway. One thing that I do recommend doing is collecting all the fees that are necessary under our land use code for a residence. So it already has a driveway permit, but there's road impact fees, there's septic fees, those types of things that have to be done, which unfortunately for the owner will cost more than what she would save in taxes. And I think I had a discussion with planning about this. I think that they should pursue those. And if they're unsuccessful in pursuing those, then you can file an action in county court here and pursue penalties that way. I don't know how far you all think it should go, but I do think that planning should say, hey, look, you say it's a residence, then we're going to treat it like a residence and collect the fees that they're entitled to under the land use code. The only other thing I wanted to mention was, I think it was last week, you had the discussion with the district attorney's office regarding jury trials. I kind of wanted to chime in, but didn't want to toot our horns any more than necessary in front of the DA's office. So we've had two kiddo cases that have gone to jury trial since the courts have opened back up. We've won them both. It's not something to brag about when we're talking about families. We don't like really getting into facts of the allegations or anything like that. Ian, I say we, Ian, I was there, but Ian's the one who did all the work on those. Won those two jury trials. So we've had two since the courts have opened back up, and glad because it just, I think, shows that the jury agreed with our logic and reasoning of the direction we wanted to go with these families. Our goal isn't to win trials. Our goal is not to win anything with social services. It really should be to help these families out, help keep them intact if at all necessary, help them through hard times. And most of the families that we're dealing with are not in the ideal situations. So again, it's not something where we should be celebrating that we won the jury trials, but we did. So that's it. That's all I have.
Very good. Just here's one of the things that every time we're dealing with insurance companies and we know we're right and we're in the right, and the insurance company settles for an egregious amount just to settle a case, is wrong. However, that's what it's come to, but it's still wrong. And I just want to make that statement. So what we're looking at with this shed is, if we can go back and you guys can look at those photos, it's
silly.
clearly a shed.
It's
And
not a residence.
It's not big enough to even sleep in unless you're vertical. You can't get horizontal in there because there wasn't enough room.
There was testimony
It's a
that
shed.
there were cots in there and that they slept on cots.
Well,
I mean,
again,
you know, I'm not saying that it's true or not true, but it doesn't appear to be real consistent with the facts on the ground.
the facts on the ground of the pictures that we showed is why we supported Leslie in the decision that it is clearly a shed, which is wrong. So part of me wants to fight this, but you know, at what expense? Are we spending more money fighting it? Or do we just go through the planning to get the recommendations of the funding that if you're gonna have it a residence, then you gotta comply with X, Y, and Z, and if you're gonna leave it open land, then you have to comply with X, Y, and Z, so.
I understand it's for sale.
Frustrating.
And, you know, if it turns out to be, that these people are gonna develop it and put a residence on there, then, great, tax it as residential. Otherwise, the new owners, if they keep it vacant, you know, we'll put a good change to vacant.
So does she
They
just
can.
take out, because the way I understand it, it would be just for the driveway and the property, what it occupies as far as acreage? So it could be 1 acre taken out for residential, the rest would still be open?
I mean, you do it by, I should probably defer to Leslie on that, but I think it's the whole property. You can ask that your property be zoned differently, but then I think they'd go through the planning process. I don't think that the assessor is going to look at the property and say, oh, well, this little piece is residential and the rest is vacant. So it's the entire property. I can't recall how big that property is. It's not huge. I want to say it's,
I think it was a 35 acre
is it that big?
parcel, and I could be wrong, that was.
I don't remember.
That was
It's
a
a
long
year
time
ago.
But
Yeah,
Anyway.
I thought it was significantly smaller, but
I think
can't
it's just
remember.
wrong. You can't put a shed on something and claim that it's a resident, because
Right.
this shed was tiny.
It is. I'm not on the property owner's side here, but in her defense, Mr. Davis, the former assessor, and Mark Vanderpool, his predecessor, both did tell her that if she did this, they would classify it as residential. Told her the size shed she needed to put on there, how to, you know, the certain dimensions, specifications for it, and she exceeded that. And so, you know, you could understand, I think, why she'd be upset that a new assessor comes in and changes it. In my opinion, the new assessor did the correct thing.
Okay. Well then, gentlemen, I think we have our planning department reach out to them and collect our road fees and go a different route.
Which
That's
costs-
just my opinion.
Costs significantly more than the taxes.
So which direction do we want? To give Shaq the direction to head?
I think if she wants a residence, she's gonna get a residence. You know, gonna pay the road fees, gonna pay, you know, septic's gonna have to be taken care of.
Road fees, I think, might be over $1,000.
Yeah, I mean,
Okay, Shaq, it sounds like, unless
That's-
you
that's
have
my
an
No,
opinion.
opposition to
that's-
that,
if it's residential,
have Don reach out to her and say that we've got to go to that route to be consistent with everybody else in the county. All right, thank you, John. Shaq.
All right, first, normally CSU would participate today, but they have prior obligations, or they're all working at the Pinion Project today. So they want to make everybody aware of this survey out there. My translation would be horrible, but for those people who need bilingual services, you can scan that deal with your phone and take the survey and help CSU determine how they can provide better services to our non-English speaking population. Participated last week in a demand management study that, discussion that Colorado Water Congress was putting on. Everybody is well aware by now from the updates we've had that the amounts of water in Lake Mead and Lake Powell are reaching critical levels where they're looking at, will they continue to be able to provide electricity, reliable electricity? Will they be able to provide potable water to Phoenix, to Las Vegas, to Los Angeles? And so the people who run the Colorado Water Compact will make a determination sometime next month whether or not to begin voluntary demand management starting in January 2022. Of course, voluntary demand management, they continue to promise, would be voluntary, temporary, and compensated. They've yet to answer what happens if they don't get enough volunteers. They do not say how long temporary is, and they do not say who will be doing the compensating. But they had a series of questions trying to do research, and Ken Curtis participated in this and said, until you can give us some solid numbers to look at, how many acre feet you want from each basin and what that means to each basin, stop wasting our time. And pretty much everybody on the call was of the same opinion. Until you can give us some kind of specifics about anything, nobody's interested. So I think it's just as heated and controversial as it's ever been, and nobody's giving any numbers. And I think everybody agrees that trying to store water in Lake Powell and Lake Mead, where the temperatures are well over 100 degrees and the water's sitting there and evaporating, is not actually storing water. So basically they went nowhere with this, and but some kind of decision will be made next month. So I guess everybody should be aware that it's coming down the pike, and they don't even know what it is or what it's going to look like. But from the local people in our basin, they're saying until you give us some specifics, stop asking goofy questions. So I sent you all the expenditures report with April's numbers that you just approved. I'll have May for you next week during my report. But here are the totals. So including the 1.62 million from social services, the total spent by the county in April was $3,821,763.19.
Okay, Joel, to move that forward.
So I would move that we pay the April bills here. And it would be in the amount of $3,821,763.19, less the amount we've already approved for social services in the amount of $1,625,793.37.
Second.
So it's been moved and seconded to accept the payables for April, up to April 30th, 2021, in the amount of $3,821,763.19. All those in favor?
Aye.
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 And that will conclude my report.
Okay. Commissioners, to my right.
Actually, phones have been pretty quiet lately. Been doing a lot of reading, catching up. Water's still at the top of the list. I'll be zooming in tonight for the city council meeting and work session. And as a side note, I was just notified Tom Butler has passed away.
Oh, wow.
So he was our chairman of the area agency on aging. And that's all I have.
Condolences to the family, for sure. Joel?
Yeah, last week we attended the emergency and disaster training through Homeland Security, and had quite a few phone calls and stuff on, our County Road 21 deal and stuff down here. I think we need to talk to John about sending the second step in letters and stuff to him, because nobody seems to be caring about all the first letters that was sent out.
So I think we also discussed this a little bit yesterday in our work session. And I think, the initial response has been, hey, yeah, sure, come down, inspect the property, which we've done that. It did comply with the septic regulation. However, it does not comply with anything with the land use code. So I would agree with Commissioner Stevenson. We've had so much outcry publicly and personally through our phones that they want these places cleaned up. So
Right.
basically, we're just going to follow the land use code, and the next step, I think, is the certified letter from our attorney that states, hey, here are the fines that are or can be imposed, I think is where you're
Right.
headed, and that we intend to do this if you don't get the properties cleaned up.
I can't remember whether or not I cited the maximum penalties or not in my last letter, but I need to look at what we sent them. We don't need to give them a lot of notice, but we do need to give them notice before we file an action in court. So that's theoretically where these would be going, is we say, here's your deadline. We can choose whether or not that's a month away or what. And if not, I mean, I don't like making empty threats and not following through on
And
them, but
that's
if they
correct. And I
don't,
think-
Yeah.
I think
Then
that's where we're at with the
we file
first.
an action.
The first initial response to them was, this has been brought to our attention, and we intend to carry it through.
So how we collect fines is we need court orders for them, and so we have to file it into court.
Right.
So I think we followed up with a letter, give them a deadline. and-
So what's the deadline? Is 30 days enough? Is that reasonable?
I
Is
mean,
that,
30 days is reasonable.
okay.
they've had enough time already.
They've had 3 months right now, and they've
Right.
not complied with anything, so.
Yeah, I mean, that's more time than the law requires, but I think that's a fair amount of time.
Well, I think we still want to be fair.
Right,
Right.
of course. I mean, we very rarely have taken people to court over land use code violations. We have, but not frequently, and so we always
Well-
try to just take care of it outside of court.
And I think we've tried to take care of it outside of court, but we keep these camps or whatever you want to call them.
Right.
They're
Meth
continuing
distribution centers?
To move around, and we need to get these things cleaned up. With everything that's going on
Right,
in them.
so we'll give them 30-day notice.
I would say 30 days, I think
Yeah, I
that's
think so.
agreeable. And let's take the next step, and then we'll go all the way if we need to.
Sounds good.
Okay. Anything else, Commissioner?
No, just a lot of reading this week, trying to keep caught up on everything, water and everything that's happening in the world.
Okay. Also, too, for my report, all 3 commissioners were at that disaster training for senior officials, and that was Thursday night. A little bit different training than I've been involved with, but somewhat similar to it, just in a different role. And I agree with Commissioner Lindsay that for the first week in a long time, it seemed like, other than dealing with the road issues, that these gentlemen keep forwarding their phones to me. It was actually somewhat manageable and quiet in those regards. We did have some issues that we talked about yesterday at our workshop. One of the bigger items that we're wrestling with, and just to be transparent and out there for everybody, we did have a Zoom meeting. We met with Magellan Strategies, Ryan Winger, and kind of discussed what they can do for us as far as polling, to see if the community would even like for us to look at a sales tax with our declining revenues that we have from Kinder Morgan, what we know we're going to get hit with this year for 2022 when we start our budget.
So for those who are out there listening that maybe are unaware of what's going on, Kinder Morgan, which is by and large the largest part of revenue we get, their production for 2020, not surprisingly, was down 36%. Additionally, the state senate voted 2 weeks ago today
Yes.
to reduce the residential assessment rate by 0.2% and the commercial assessment rate by 2.6%. So the overall impact to county revenue is going to be north of $2 million. Obviously, the assessor hasn't produced final figures yet, so that's got to be made up. And as well as you see, every week people are in here asking, can you fund this, can you fund that? So I think to maintain status quo, we've got to, we will either have to increase our revenues to maintain what we're already doing, or we will have to reduce the services we're providing. And for as long as Montezuma County has existed, the only people that have participated in providing for the services are the property owners. So is it fair to go back to the property owners and ask them for another mill increase, or do we ask everybody to contribute through a sales tax, including the 700,000 plus people who come to Mesa Verde every single year, who use our infrastructure, use our emergency services? You know, sales tax is charged at the end use when you order online now, and people ordering on Amazon and whatever off the internet. We've got UPS and FedEx trucks going up and down the county roads all day long delivering those things, and they're not helping to contribute to repairing those county roads. So it's a question we're going to have to wrestle with. How do we provide services or decrease services or increase revenue?
So to finish up with that, thank you, Shak, I appreciate that. The commissioners are wrestling with it. You know, obviously tax is a 4-letter word. However, we're going to basically put it out there through this poll to see what the pulse of the community is. And whatever that is where we'll head. We obviously know that we're gonna be hit with one or the other of what we need to do, and that could be decreasing services, or we'll see what we can come up with this poll. So more to come on that from Magellan Strategies LLC. We did have an executive session. We did discuss CSU, the visit that we're going to have on July 12th. Myself and Shak will be zooming into that meeting. Commissioner Lindsay and Stevenson will be here. And that's basically in regards to the MOU that CSU currently has with us. It hasn't been updated since 2008, which is drastically outdated, which is supposed to be done annually. But specifically for the 2 agents that are supposed to be here in Montezuma County, and we haven't had 2 agents in a significant amount of time, and we've asked for that for as long as I've been on this commission. We did talk about the SRS funding, and that's already been discussed through Attorney Baxter. And let's see. Did have a legislative update on Friday, the last, which was just a recap through CCI. I think everybody understands and realizes now what has passed and what hasn't passed. I did send a email to you last night, Shak, which was specifically what they think HB 260 is going to generate as far as us for our revenue into the county. Those funds are still going to be split just like the HUTF fund, 60, 22, and 18. So the 22% that we'll be receiving for the county will be within that spreadsheet, and I sent that to you last night.
And,
so
and I got that out to Doug and Rob as well.
Start planning on that. Other than that, that will conclude my report.
And Supreme Court did strike down the pause
Oh, they did yesterday.
act yesterday.
Yeah,
So-
we got an email from CCI that we don't have to worry about that one. So Initiative
Maybe.
16, well,
Unless they
Well,
redid it.
well, those people have to go
Unless
back to the
they-
drawing
Unless they
board.
write it with different language.
It can always come back as
Yeah.
any kind of a balloted initiative, but
But as of right now,
it looks
we're in good shape.
like it's,
yeah.
it's done. CCI did, I think you guys probably saw that email that all 64 counties collectively from CCI put out
Yeah.
an opposition to that. So,
Has that ever happened?
not, well.
Not often
I
if
can-
it has.
I can only speak for 2.5 years, and in my 2.5 years, that has never happened. But this was unanimous. It was voted at CCI at the conference, and everybody was in favor of the opposition of Initiative 16. So, with that, gentlemen, I would entertain.
Move to adjourn.
Second it.
It has been moved and seconded to adjourn this meeting of June 22nd, 2021. All those in favor?
Aye.
Aye.
Aye.